If you've been trying to hide your varicose veins, don't. There are options to remove them. Here to tell us about the process is Dr. Gamal Wazni, founder of United Vein Centers. Welcome, Dr. Wazni.
Thank you.
Thanks for being here. This is a great time to talk about this because, as we said, it's warming up around town. It's short season. Why did you decide to get into the field of vein disease?
Back when I was training as a resident many years ago, lasers were just coming into the market. And we used to treat severe vein disease with vein stripping. So when these came into the market, it was fascinating to watch medical technology, these sophisticated lasers, rid the vein disease in less than an hour.
The stripping, that sounds painful.
Correct. Stripping is an old procedure where the physicians would rip out the large bulging veins.
Wow. So now obviously that process has really changed.
Correct.
But there's different types of veins out there. How do you know if you do have a vein issue and it's something that you need to seek help for?
Good question. If you have large bulging veins, or if your legs ache, swell, feel heavy at the end of the day, maybe cramp, or you have restless legs at night, then you most likely have vein disease from the pooling of the blood in the bad veins.
What is the difference between, there's varicose veins, there's spider veins? Is one worse than the other? I know there's several others as well.
Correct. The veins right under the skin, the surface veins, once they become diseased, they enlarge, they start to bulge. Then you start seeing them on the surface of the skin. These bulging veins are considered varicose veins. Something not as serious is spider veins. These are usually flat, little veins. That would be cosmetic. But if there's unsightly bulging veins tied to symptoms such as the pain, aching, swelling, cramping, or restless legs, then that's vein disease, a medical condition. The other's a cosmetic issue.
I think some people who don't have these issues think it is just a cosmetic, but it is so much more than that, and that's why it's vital to get treated.
Correct. About 20%, 1 in 5 individuals have true vein disease, meaning the symptoms with the bulging veins.
How does it develop? How do you get vein disease? Do we know?
It's hereditary.
It is hereditary.
Most individuals that come into our offices, when we ask them, any family history of this, most of them with serious disease will tell you they have a parent or a grandparent, an aunt or an uncle with similar symptoms and sign.
Let's get back to the treatment here for a minute. Obviously, as you were talking at the beginning of the segment, that has advanced so much. What are some of the options out there?
Well, it has the gold standard by the American Society of Vascular Surgery is to use ablation, meaning these new technologies of laser or radio frequency where we are burning the vein closed. So instead of ripping it out, through a small puncture in the skin, kind of like a blood draw. Instead of taking blood out, we enter through a tiny needle and we put a laser fiber in there and we heat or seal the vein closed. That is considered much less painful. You're in and out. You will have some soreness in your calf or your thigh when you're done, but there's no downtime for the most part.
So if someone at home, they want to get checked out and see what needs to be done if they think they have a problem, you offer a free vein screening, correct?
We do, yes.
How does that work? What do people need to do to sign up and make an appointment?
They'll give us a call. Our doctors are there. Their main goal is to make your legs feel like new. So call us at 1-800-NEW-LEGS and we'll offer you a free vein screening.